Yes, a gummy bear, because I'm a... Oh, I think we're recording. All right, equilibrium. This is part 3, Holes, chapter 12, part 3b, I guess, equilibrium. So there's two types of equilibrium. There's static equilibrium, and there's dynamic equilibrium. Whoa, dude! Okay, so static equilibrium is taken care of by the vestibule. We'll talk about that. Dynamic equilibrium is done by these semicircular canals. I don't have a third hand, or I'd show another plane. And so what is static equilibrium? Your body is not moving, but you know positionally where you are, where you stand. This is in relation to this. My head is here, my arms are here, and so on. Dynamic equilibrium is when you are moving around, your body is kind of trying to play catch-up and understand where exactly your body is at that time and how to react. So let's first talk about the vestibule. We're in this region here, between the semicircular canals and the cochlea. The vestibule specifically is the communication point, or the center area between these, and incorporates the utricle. And the utricle you see here is found at the base of the, let's just say part of the vestibule, and it communicates with the saccule. The saccule is found here. You see this extension of the membranous labyrinth here, this saccule. And inside the saccule, of course, again, is endolymph still. So the utricle communicates with the saccule and the semicircular canals. It's the entry point between the semicircular canals and the saccule, that is the utricle. Now, the saccule communicates with the cochlear duct, as I mentioned, because of the presence of endolymph. And then the macula are hair cells of the utricle and the saccule. And we'll show you what that looks like here in just a second. Here's the macula. So this is now static equilibrium, okay? When your head is upright, your macula of the utricle sit like this, and this gelatin-like substance that you see here, this is the silver or the gray jello. Inside the gray jello, you've added some sensory neurons, some nerve fibers, nerve receptors, hair cells. These hair cells don't hear, nor can they be cut at a haircut. They move only when that gelatin moves. And the gelatin is only going to move because of these otoliths. What are they called? Right, otoliths. And they are like teeny tiny rocks. They're actually made of calcium carbonate. And they're heavier, and in response to gravity, they move. So if I'm sitting like this, then the rocks sit steady, and my body knows what position they're in, and my hair cells don't bend. I know that I'm vertical. If I lower my head like this, the otoliths fall due to gravity, and that causes the gelatin to also fall. And now the hair cells are going to bend. And when the hair cells bend, they're going to send a action potential through these neurons and then up through the vestibular motor, vestibular neuron, saying my head is bent in this direction. Okay, that's in the macula. Once again, we're looking here. These two green structures that you see there, the macula are within a saccule. Okay, so the saccule inside, you have the macula. Okay. Now, here we have these semicircular canals. Again, they're laid out in XYZ planes. There's 3 canals at right angles, the same kind of bony canal and membranous canal and so on, or labyrinth. So the ampulla that you see here, 1, 2, 3, or ampullae, plural, are the bony or the enlargements at the bottom of every semicircular canal. And they're going to help you identify positioning in 3-dimensional space. They're going to communicate with the vestibule, shown here. And within each ampulla, we have a crista ampullaris, which is the sensory organ of the ampulla. Again, here we're going to have our hairs and some gelatin, some more jello. And this is where we're going to be able to know when we're moving our head like this and so on. Here we have the crista ampullaris. Now, the crista ampullaris works in an interesting way. Around the crista ampullaris is endolymph, and that's going to cause the crista ampullaris to move and shift. But sort of a little-known fact is that if this is my crista ampullaris, and I quickly shift my head around in this way, the crista ampullaris is actually going to initially bend away. You can see the paper, if I shift my head, the paper bends this direction. Okay, the crista ampullaris will bend that way, and that bending is going to cause these little hair cells stuck into the cupula. This is the gelatin-like structure of the crista ampullaris. And those hair cells are going to move, and in response send an action potential down through these sensory nerve fibers that your head is moving in that certain direction, or if you like, opposite that certain direction. Here you see the flow or the movement of the endolymph. That movement of the endolymph is like a split second right after the crista ampullaris bends as sort of a secondary effect, but it's tied with the movement of the cupula, and thus the bending of those hair cells and the identification of which direction you're moving. These sensory neurons are going to send the information again over to the medulla, and then to be processed accordingly in the brain as far as body position. So that is static and dynamic equilibrium. Hopefully that makes sense. Go over it in the book once again for your benefit.